Gastrointestinal bleeding. Patients may present with the problem of hematemesis, vomiting blood, melena, passage of jet black stools, or hematochezia, passage of bright red blood per rectum. Sometimes patients may present because routine testing for occult blood in the stools is positive. It is important to ensure that if vomiting of blood is reported, this is not the result of bleeding from a tooth socket or the nose, or coughing up of blood. Hematemesis indicates that the site of the bleeding is proximal to or at the duodenum. Ask about symptoms of peptic ulceration. Hematemesis is commonly due to bleeding chronic peptic ulceration, particularly from a duodenal ulcer. Acute peptic ulcers often bleed without abdominal pain. A Mallory-Weiss tear usually occurs with repeated vomiting. Typically the patient reports first the vomiting of clear gastric contents and then the vomiting of blood. Hemorrhoids and local anorectal diseases such as fissures will commonly present with passing small amounts of bright red blood per rectum. The blood is normally not mixed in the stools but is on the toilet paper, on top of the stools, or in the toilet bowl. Melena usually results from bleeding from the upper gastrointestinal tract, although right-sided colonic and small bowel lesions can occasionally be responsible. Massive rectal bleeding can occur from the distal colon or rectum, or from a major bleeding site higher in the gastrointestinal tract. With substantial lower gastrointestinal tract bleeding, it is important to consider the presence of angiodysplasia or diverticular disease, where bleeding more often occurs from the right rather than the left colon, even though diverticula are more common in the left colon. Spontaneous bleeding into the skin, or from the nose or mouth, can be a problem for patients with coagulopathy resulting from liver disease. More common causes of acute upper gastrointestinal tract bleeding. 1. Chronic peptic ulcer, duodenal ulcer, 40%, gastric ulcer. 2. Acute peptic ulcer, erosions. Less common causes of acute upper gastrointestinal tract bleeding. 3. Mallory-Weiss syndrome, tear at the gastroesophageal junction. 4. Esophageal and/or gastric varices. 5. Erosive or ulcerative esophagitis. 6. Gastric carcinoma, polyp, other tumors. 7. Douloureux ulcer, single defect that involves an ectatic submucosal artery. 8. Watermelon stomach, antral vascular ectasias. 9. Aortoenteric fistula, usually aortoduodenal and after aortic surgery. 10. Vascular anomalies, angiodysplasia, arteriovenous malformations, blue rubber bleb nevus syndrome, hereditary hemorrhagic telangiectasia, CRST syndrome. 11. Pseudoxanthoma elasticum, Ehlers-Danlos syndrome. 12. Amyloidosis. 13. Vasculitis. 14. Ménétrier section disease. 15. Bleeding diathesis. 16. Pseudohematemesis, nasopharyngeal origin. More common causes of acute lower gastrointestinal tract bleeding. 1. Angiodysplasia. 2. Diverticular disease. 3. Colonic carcinoma or polyp. 4. Hemorrhoids or anal fissure. Less common causes of acute upper gastrointestinal tract bleeding. 5. Massive upper gastrointestinal bleeding. 6. Inflammatory bowel disease. 7. Ischemic colitis. 8. Meckel's #diverticulum. 9. Small bowel disease, e.g. tumor, diverticula, intussusception. 10. Hemophilia, bleeding from the gallbladder. 11. Solitary colonic ulcer.